Hello, my name is Dr. Randy Thomas. I'm the director of the Cardiovascular Health Clinic at the Mayo Clinic in Rochester, Minnesota. And I'd like to talk to you today briefly about preventive cardiology mythbusters. I'd like to cover very briefly a couple of points that may help you as you're trying to differentiate between fact, such as we see here with penicillin as a miracle drug, and fiction, such as this unusual hat that may help or may not help with hair loss. I'd like to focus on a couple of areas in particular, exercise and nutrition, because these are very common areas of myths in preventive cardiology. First of all, under exercise, we often hear that running is the same as walking when we look at effects for cardiovascular risk reduction. If we look at the evidence, walking and running are not the same with regards to caloric expenditure, the number of calories that we expend. In fact, if we walk 1 mile at 3 miles per hour, or if we run a mile at 6 miles per hour, we will be burning about 40% more calories running than we will walking. Likewise, if we run instead of walk, we'll have greater effects on lowering the risk of heart attack and stroke. However, walking and running, as long as we're burning the same number of calories with each activity, appears to reduce cardiovascular risk factors about the same. But overall, walking, although very beneficial, is not quite as beneficial as running might be, as long as we can tolerate the running activities from a knee and hip perspective. With regards to nutrition, this is another very common area where we see myths occurring, and we seek to identify what the evidence is versus what the myths are. For example, often we will hear that low-fat diets or very low-fat diets are the best for lowering cardiovascular disease. We also know that there are other types of dietary patterns that are promoted, including Mediterranean-style approaches to eating, where we have fruits and vegetables, whole grains, healthy oils like olive oil, canola oil, avocados, fish, and so forth. A low-fat diet minimizes all sources of fat. A Mediterranean diet lowers the source of saturated fats. Well, if you look at the evidence, unfortunately, low-fat diets that have been tested for randomized control trials, where we have one group getting the trial or the treatment and another group getting a control treatment, those studies have not shown very significant benefits in reducing cardiovascular events for people on a very low-fat or a low-fat diet. However, a Mediterranean-style diet has been tested in 2 separate studies looking at its effect on reducing cardiovascular events. Those studies have been shown to reduce significantly heart attack rates and stroke rates among people either with disease, with heart disease, or even in those who don't have disease yet. So do low-fat diets help? They may help and are very helpful in certain circumstances for weight control and other reasons, but as far as the evidence of what lowers the risk of cardiovascular disease events best, currently the Mediterranean-style approach appears to have the best evidence. Now to cover a couple of fairly quick mythbusters under nutrition. The first has to do with chocolate. Does chocolate help to reduce cardiovascular risk? A few studies have looked at this in randomized controlled trials, again where you have one group getting the chocolate and another group getting a fake chocolate, so to speak. And the study suggests that there are various risk factors for heart disease that improve with modest amounts of chocolate each day. A second area to discuss, it has to do with coconut milk or coconut oil. There's a popular myth that coconut oil or coconut milk help to reduce cardiovascular risk factors. Most studies that have been done are not very large studies and tend not to show significant benefits for cardiovascular risk reduction. In fact, coconut oil and coconut milk have some of the highest concentrations of saturated fat of any food products that we may be able to find. So that appears to be a myth. In summary then, exercise and nutrition are very strong factors that help us reduce cardiovascular risk. But it's important to remember what fact and fiction are. In the cases that we discussed today, exercise is very helpful, but running appears to have a bit more benefit than walking, pound for pound, so to speak. And under nutrition, a Mediterranean-style approach appears to have more evidence than a very low-fat or low-fat diet. We here at Mayo Clinic seek to help separate fact from fiction and look forward to working with you in the future as you try to do that as well. Thank you very much.